that these are the number one, external oblique muscle, internal oblique muscle, and transversus abdominis muscle, right? Their tendinous or aponeurotic parts, they are going to form this sheath, which is just going to enclose these vertical strap muscles of the anterior abdominal wall. Is it clear, Ji? So rectus sheath is a tough aponeurotic tendinous long fibrous sheath basically that encloses the rectus abdominis muscle and the pyramidalis muscle. Now, what is its function? Its purpose kya hai? Why nature has designed this thing, this sheath, to enclose these two muscles, right? Number one, if it is thick and aponeurotic, of course, it is going to provide what? It is going to provide the strength. Okay? So it is going to strengthen the anterior abdominal wall. Number one. Okay? I'm talking about the functions of the rectus sheath. Number one is going to do what? It is going to give strength to the anterior abdominal wall. And number two, it is going to increase the efficiency of this long strap muscle. ठीक है, this rectus abdominis muscle की efficiency को ये increase करेगा. How? Because this rectus sheath की जो anterior layer है, it is going to be attached with these tendinous intersections of this muscle, so that it is going to keep this muscle straight during the contraction. ठीक है? When this muscle will contract, this part of the muscle will not, bulge forwards. It is strictly adhered along with the anterior sheath of the rectus of the rectus sheath. Is it clear, Ji? So the purpose of rectus sheath, number one, it is going to give the strength to the anterior abdominal wall, and number two, it is responsible for increasing the efficiency of the rectus abdominis muscle. Now, what would be its contents? इसके contents में क्या क्या होगा जी? सबसे पहले तो हमने in the definition we told that it is going to enclose the rectus abdominis and the pyramidalis muscle, right? So इसके contents में सबसे पहले we got the two structures. Number one, the rectus abdominis muscle and the pyramidalis muscle, right? Other than these two, here you can see that we have just reflected the rectus sheath from here, and here we can see the contents of the rectus sheath. So we have got this muscle. This is the rectus abdominis muscle, pyramidalis niche, right? And then we have got these vessels. These are the superior epigastric vessels. ठीक है ना? Superior epigastric artery is a branch of जी कौन बताएगा?
Internal thoracic artery.
So it is one of the terminal branches of the internal thoracic artery, right? So it is going to enter from here, right? There is a gap within the external origin of the diaphragm. It's going to enter over here. The superior epigastric vessels, and of course here you can see the inferior epigastric vessels. Okay, ji? So contents maybe have got the rectus abdominis muscle, pyramidalis muscle in the midline over here, and then we have got the superior epigastric vessels and the inferior epigastric vessels. And besides, we have another structures over here, and that is what? This is a see the anterior rami of the lower 6 thoracic nerves. Okay, 6. You can see this here. You can see here we have just reflected removed some anterior layer of the rectus sheath. And you can see the nerves entering in the rectus sheath. Piercing the rectus sheath, they are going to spare the superficial and going to spare the skin in this region. Here you can see this one, right? So we have got the anterior rami of the lower 6 spinal nerves over here. So the contents, maybe we have got the 5 contents of the rectus sheath. Number one, we have got the rectus abdominis muscle over here, then the pyramidalis over here, then the vessels like superior epigastric vessels, inferior epigastric vessels, and then the anterior rami of the lower 6 spinal thoracic nerves. Is it clear, जी? कोई problem? जी यहाँ तक clear है जी? Rectus sheath, its functions, and then its contents. Okay, now how it is formed? Here you can see it is formed by the aponeurosis of the three concentric flat muscles, right? You can see the rectus abdomen, the aponeurosis of the external oblique, internal oblique, and then the transversus abdominis. And these three concentric aponeuroses, they have got the specific arrangement. Okay, beta. Now this specific arrangement, to discuss this specific arrangement, we'll discuss it at the 3 levels, right? कौन-कौन से level पे करेंगे जी? Okay. First of all, we are going to, consider at the level of the above the costal margin. ठीक है? Costal margin say above. Above the costal margin, here you can see that it is only its anterior wall. It is only formed by the, you see, this is the rectus sheath over there, and this is the rectus abdominal muscle which is being enclosed. So here you can see that it is just formed by the aponeurosis of the external oblique muscle. So at the above the costal margin, right? Above the costal margin, its anterior wall is formed by the aponeurosis of the external oblique muscle. ठीक है जी? And the posterior wall, this posterior wall is contributed by the, you see, the costal cartilage of the 5th, 6th, and the 7th costal cartilages, and the intercostal spaces in between. Is it clear, ji? So above the costal margin, okay, above the costal margin, it is basically contributed by the anterior wall is contributed by the aponeurosis of the external oblique muscle only, and the posterior wall, it is contributed by the 5th, 6th, 7th costal cartilages along with their intercostal spaces. ठीक है जी? कोई problem तो नहीं है बच्चे? Now, then at the other place we are going to discuss it between the costal margin and the anterior superior iliac spine. ठीक है? Costal margin or anterior superior iliac spine के ऊपर we're just going to talk about it. And here you can see the anterior wall is formed by the external oblique aponeurosis, and here the internal oblique splits to enclose the superior and the inferior layer, and then the superior layer split layer of the internal oblique aponeurosis, right? So anterior wall is formed by the external oblique aponeurosis and the superior layer of the internal oblique aponeurosis. And the posterior wall, it is contributed by the inferior layer, rather anterior and the posterior, the posterior layer of the internal oblique aponeurosis over there, right? And then the other one is the transversus abdominal aponeurosis. ठीक है जी? So between the costal margin and anterior superior iliac spine, this tendinous sheath, it is formed anteriorly by the external oblique aponeurosis and the anterior layer of the internal oblique, and then the posterior layer is formed by the transversus abdominis and the internal layer or the posterior layer of the internal oblique muscle. कोई problem तो नहीं है बेटे? And then below the level of the anterior superior iliac spine, ठीक है? और the anterior superior iliac spine से लेके pubic tubercle तक, ठीक है? Pubic region तक, it is, have the different arrangement. That is that anteriorly it is lined by the both of 3 aponeuroses: external oblique, internal oblique, and the transversus abdominis. And its posterior wall is deficient. Here you can see there is no aponeurosis in the posterior wall below the anterior superior iliac spine. ठीक है जी? Is it clear? And here this, these muscles, they lie directly over the fascia transversalis. ठीक है ना? I told you ना कि transversus abdominis को internally कौन सा abdominal fascia line कर रहा है? That is the fascia transversalis, right? So over here you can see the transversus abdominis भी anteriorly चला गया, and only the fascia transversalis is residing over there, is present over here. So this muscle, it is lying directly basically over the fascia transversalis. Is it clear, ji? The problem, बच्चे?
Sir, coastal margin वाला बार explain कर लें.
Okay. Okay. We'll talk about the rectus sheath arrangement at 3 levels. Here, above the costal margin, ठीक है, कोस्टल मार्जिन से above, right? Above the coastal margin, it is only formed by the anterior layer is formed by the aponeurosis of the external oblique muscle, right? Okay. Below the coastal margin, between the coastal margin and the anterior superior iliac spine here, this level, right? The external oblique anteriorly and the aponeurosis of the internal oblique anteriorly. Okay. So the posterior wall at the level of the coastal margin told you that it is contributed by these spaces, 5th, 6th, and 7th costal cartilages here. 5th, 6th, and 7th costal cartilage. Here you can see this. 5th, 6th, and 7th costal cartilage. This is the level here. Okay, coastal margin P, you can see the posterior wall is contributed by the 5th, 6th, and 7th costal cartilages and their intercostal spaces here, right? और इसके anteriorly ये देखें ये आ रही है, यहाँ से we have just split this, aponeurosis over here. So anterior wall is contributed by like this. और ये जो spaces यहाँ तक extend करनी है, these are going to form its posterior wall. ठीक है? Now post 6 से यहाँ से from the coastal margin से नीचे से we up to the anterior superior spine, anterior wall is contributed by the external oblique and then the superior layer of the or the anterior layer of the internal. ठीक है ना? इस level पे आने के बाद internal oblique जो it is going to split in the two layers, the anterior and the posterior. ठीक है? Anterior जो है वो anterior wall बनाएगी और posterior जो इसकी posterior wall बनाएगी. ठीक है जी? तो posterior wall पे we have another third muscle, that is a transverse abdominis muscle, उसके aponeurosis को बना रहे हैं. ठीक है? Now below this level over here, internal anterior superior iliac spine से नीचे ये जो wall है, it is totally anterior wall is formed by the 3 aponeuroses. Or posteriorly this wall is deficient. I'll just show you somewhere else. इस पिक्चर पे आपको ज्यादा क्लियरली यू कैन फील दैट. ठीक है बेटा? You can see all the 3 aponeuroses, they are passing in front of the, right? So anteriorly, anterior wall is formed by all 3 aponeuroses. And posterior wall, this one, this brown line, it is representing the fascia transversalis. So here this muscle lies directly over the fascia transversalis. Okay, but you just have a look over here. Now, this is the place we have just removed this muscle, right? Here you can see rectus sheath we have just split it up over here, and you can see this muscle over here. ठीक है? और ये आपको this is the posterior layer. आपको ये vessels के नीचे जो आपको concentric lines नजर आ रही हैं, this is basically the posterior layer of the rectus sheath. ठीक है? That is extending from the coastal margin up to the anterior superior iliac spine. ठीक है? और ये देखिए anterior superior iliac spine के इस level पे this wall is deficient. It is represented by this semilunar, एक और आपको यहाँ पे एक line नजर आ रही है, right? This line, this margin, ठीक है? This is called as the arcuate line. ठीक है? And this arcuate line is basically representing what? It is representing or demarcating the lower limit of the posterior wall of rectus sheath. ठीक है जी? यहाँ तक आपकी posterior wall आ रही है और यहाँ पे आके ये आपकी rectus sheath की posterior wall खत्म हो जाती है, right? इसके लिए you can see ये हमने muscle remove किया है, तो ये muscle यहाँ पे below this line it is lying directly. ये आपको जो नजर आ रहा है, this is the fascia transversalis, right? So this muscle is lying directly over the fascia transversalis. You can see here. ठीक है? So this line, this semilunar line, that semicircular line, that is basically representing the lower limit of the posterior layer of the rectus sheath. ठीक है जी? Is it clear? And that's where this line is also called as the arcuate line or semicircular line of the Douglas. ठीक है जी? Is it clear? So posterior wall of the rectus sheath, it is deficient at the level of the anterior superior iliac spine, which is marked by this semicircular line, and that is called as the arcuate line. Okay, ji? Below this strap long muscle, it is lying directly over the fascia transversalis. Is it clear, ji? So anterior wall is the complete hai, that is formed by the aponeurosis, right? And the posterior wall, it is deficient below the anterior superior iliac spine. Is it clear, Vijay? The problem? Rectus
Yes,
sheath,
clear.
rectus sheath or arcuate line clear hogi. Arcuate line we used to ask the certain Viva questions regarding rectus sheath. What is the formation of the rectus sheath above the costal margin? Okay. What is below the anterior superior spine? What is the arcuate line? Okay. What are the contents of the rectus sheath? So it is a very important topic. So you must be familiar with it. Is it clear, Ji? Okay. तो ये जो आर्क्यूट लाइन है यहाँ पे, राइट, देयर इज अनदर क्वेश्चन यूज आस्क के जी, ये जो रेक्टस शीथ, ये जो आर्क्यूट लाइन है, यहाँ पे कौन सा स्ट्रक्चर, विच स्ट्रक्चर इज गोइंग टू एंटर द रेक्टस शीथ? ठीक है, इसकी इंपॉर्टेंस क्या है? सो इट इज अ साइट फ्रॉम वेयर द इंफीरियर एपिगैस्ट्रिक वेसल्स आर गोइंग टू एंटर द रेक्टस शीथ. ठीक है, ये जो आर्क्यूट लाइन है, यहाँ से ये यू कैन सी, ये आपकी इंफीरियर एपिगैस्ट्रिक वेसल्स आ रही है. ठीक है, एंड दे आर गोइंग टू enter the inside the rectus sheath to become the content of the rectus sheath, and when it will run in the rectus sheath, and then it is going to anastomose with the superior epigastric vessels. Is it clear, ji? ठीक है. So arcuate line is a level, is a place from where the inferior epigastric vessels will enter the rectus sheath, and they're going to make anastomosis with the superior epigastric vessels. Is it clear, ji? Now, here you can see this white structure, white band in the midline, and it is called what? क्या कहते हैं जी इसको? It is a linea alba, right? So here you can see this fracture sheath on the both sides, right and the left side. These are separated from each other, right? But this median fibrous band, this median fibrous band, this is called as the linea alba. So it extends from where? It extends from the Shahid process up to the, कहाँ तक जाता जी? Pubic symphysis midline. ठीक है, ठीक है, Shahid process से ये midline, ये देखिए pubic symphysis तक आ रहा है. ठीक है, it's a thin narrow band which is basically representing the line of fusion between the two rectus sheaths on the both sides, right and left, right. And here you can see above the umbilicus it is a bit wider, and below it is narrower. ठीक है, and here then is going to attach over the pubic symphysis. कोई प्रॉब्लम तो नहीं है बच्चे यहाँ तक? Everything is clear, जी? But remember one thing, that the anterior wall of this rectus sheath, it is adherent to the, is attached to the rectus abdominal muscle. Okay? Whereas the posterior wall, it is not attached with the rectus abdominis muscle. और anterior wall जो है rectus abdominis muscle से कहाँ पे attached होती है जी? कोई बताएगा मुझे जी? What is the line of attachment of the rectus sheath to the rectus abdominis muscle? कौन बताएगा?
Tendinous intersection.
जी, tendinous intersections. Very good. So ये tendinous intersections पे कोई प्रॉब्लम तो नहीं है बच्चे? Everything is clear now? रेक्टस शीथ में, इसके कंटेंट्स में, इसकी फॉर्मेशन में कोई प्रॉब्लम है तो यू कैन आस्क मी राइट नाउ. जी, ओके जी. हु कैन टेल मी अबाउट द इंग्वाइनल लिगामेंट जी? इंग्वाइनल लिगामेंट के बारे में कौन बताएगा जी? व्हाट इज इंग्वाइनल लिगामेंट? एनीबॉडी एल्स? एनीबॉडी जी? जी, इंग्वाइनल लिगामेंट, कैन एनीबॉडी What is the other name of inguinal ligaments?
Two parts.
G.
Popart's ligament.
Popart's ligaments. ठीक है. How it is found? जी बेटे. How it is found? Extension क्या है जी? कहाँ से कहाँ तक होता है जी?
Sir,
Anterior
anterior
superior. Iliac spine से.